Have you ever experienced that weird pins and needles sensation? Or maybe a limb just felt totally asleep after sitting in an odd position or sleeping a certain way? It is a common experience, but sometimes numbness can be a signal from your body that something more serious is happening. Generally, numbness warrants a doctor's visit when it is sudden, severe, unexplained, spreads rapidly, affects one side of your body, or is accompanied by other concerning symptoms like weakness, confusion, or difficulty speaking. While occasional temporary numbness from pressure is usually harmless, persistent or concerning numbness should always be evaluated by a healthcare professional. The sensation of numbness or paresthesia occurs when there is an interruption in the nerve signals traveling to or from your brain. This can happen for many reasons, from benign issues like prolonged pressure on a nerve, often referred to as hitting your funny bone, to more significant conditions involving nerve damage, circulation problems, or even issues within the central nervous system. Your nerves are like the electrical wiring of your body, and any disruption in this network can affect how you feel sensations, move your muscles, or even maintain balance. A healthcare provider can help pinpoint the exact cause by assessing your symptoms and possibly ordering diagnostic tests. So, how do you decide if your numbness needs a closer look? Pay attention to its duration and accompanying symptoms. If the numbness does not go away quickly after you change position, or if it comes on suddenly without any clear reason, that is a red flag. Be particularly mindful if you also experience significant weakness in the affected limb, a sharp or shooting pain, dizziness, vision changes, or problems with coordination. These combined symptoms could point to a more urgent situation requiring immediate medical attention. It is always better to err on the side of caution when your body is sending you unusual signals. Understanding the subtle differences in numbness can be incredibly empowering. For instance, temporary sleepy limb numbness, medically known as transient paresthesia, usually resolves within minutes as blood flow and nerve signals return to normal. This is different from neuropathic numbness, which arises from nerve damage and can feel like a constant burning, prickling, or loss of sensation. Recognizing these distinctions helps you determine when a wait and watch approach is appropriate versus when to seek professional guidance. Early intervention for nerve-related issues can often prevent more serious long-term complications. Ultimately, listening to your body and acting responsibly when it signals something unusual is key to staying healthy and injury-free. Whether it is a fleeting tingle or a persistent loss of sensation, knowing when to consult a doctor empowers you to address potential issues proactively, ensuring your body continues to function at its best, allowing you to focus on your studies and stay active. Trust your instincts, and do not hesitate to seek expert advice for any persistent or worrying numbness.